Welcome to today's video where we're going to be talking about some basics. Today's basic is the process of being referred to see a rheumatologist and some tips and advice on how you might be able to select the right rheumatologist for you. Now, this is going to vary a little bit. Every healthcare system is slightly different, and the rights you may have as a patient in that system is also slightly different. I'll start with the NHS, the UK system that is a state-funded system, because there's perhaps a little bit less choice, but in some ways that makes things a bit simpler. The first thing is that to see a specialist rheumatologist, you can't just walk into the hospital and book an appointment. Certainly not if you're using NHS services. So you'll need to see a you'll need to see a general practitioner in the first instance. To try and help for the case to see a rheumatologist, you should prepare before the meeting with your GP, putting together a detailed symptom diary of what's been going on, why you think you might need to see a rheumatologist. And it's worth just being open and upfront in the appointment. If that's what your aim is from the consultation, you might as well discuss that openly with your GP, expressing why a rheumatologist you think is needing to be consulted. If the GP does disagree, then you can discuss exactly what they might be doing in the interim as to answering the questions that you have and why they don't think that a rheumatologist is needed at that stage. In terms of choice in a sector at the NHS, you still do have choice. So theoretically, you can choose to be referred to any particular rheumatology unit of your selection. The reality is it is not that simple, because practically speaking, if you live in Birmingham and you want to see someone in Southampton, that's not going to be that practical. You might be able to do that on a once-off basis, but in the long term, having that relationship with a rheumatologist at that distance, if it transpires that you have a chronic condition that needs long-term monitoring, it's unlikely that's going to work. Some centres may actually look at rejecting referrals out of area, particularly right now while there's a high pressure on the NHS. You can do some research on the consultants in your local area to see if their particular interests may align with yours. And if you're living in the UK and you'd like to see a rheumatologist and you might want to see them sooner than you may on the NHS, you can do your research on what rheumatology consultants are available privately in your area. Okay, so what about a system that is more privatized like here in the UAE? You have a huge selection of potential rheumatologists to go and see. So it can be really quite overwhelming in terms of where do I go, who do I see. Still, geography will play a part. The practicalities of getting to the hospital where you might be able to see that rheumatologist, parking, all those sorts of things may play a factor. Though I would suggest that it's probably better to see the right person and make the journey, as transport links are pretty good here. You can do some research on the individual rheumatologists that you are thinking about seeing. So starting by looking at their clinic's biography, this should give you some understanding of whether they have a particular specialty interest area. So it might be better to see the osteoporosis specialist if you're worried about your fractures, rather than the specialist who has an interest in lupus. Although in reality, most rheumatologists should be sufficiently trained to offer a breadth of expertise across the specialty. It's only when you have very unusual or uncommon conditions that a real subspecialty expert is kind of necessary. So what about accolades and publications? Yes, they have some value. I think I'll probably do a whole separate video on whether you should see the prof or not, because that could, there's quite a few things to sort of unpack with that, the benefits and pitfalls. But obviously someone that has published heavily in, say, rheumatoid arthritis and has a lot of research and interest in that area may offer some additional benefits to someone who's perhaps more interested in something like vasculitis. Whereas again, they should be competent to deal with the whole spectrum of disease. What about reviews? Yeah, reviews are helpful. Little challenging with reviews in the same way as TripAdvisor is a bit challenging. So if you get a 4.5 star rating on a particular hotel, but the latest rating is 1 star, there's always going to be a risk that the people that are going to post a review are either exceptionally happy or exceptionally unhappy. So it's not so common to get just a 3-star review saying adequate consultation, okay doctor, feel reasonably happy. They're either very happy or are posting because they're particularly unhappy. And the other challenge for the medical professional is that unlike someone at TripAdvisor, you can't really respond to those 1-star reviews adequately because doing so might breach confidentiality. So it's difficult to come back if someone has left an unfair 1-star review. That being said, it is a source of information, and just like you would use the information on TripAdvisor to decide if it might be a decent hotel to go to or not, reviews are helpful because it does provide some feedback from the client or patients of those consultants. Word of mouth is clearly important. This will obviously be more helpful for someone who's more established in the area, but really you're going to get a lot more information from someone that's seen that individual firsthand, and lots of groups are out there where you may be able to ask the question, which rheumatologist should I see here in Dubai, and get that honest advice knowing that individual. So I hope this is helpful in making some selections about how you go to see a rheumatologist. Here in the UAE, you won't need to be referred. You can usually book in directly. Though if you're not sure, again, as with my video on what specialist should I need, family medicine specialty is probably the best person to see first, and they can decide if a rheumatologist is the best specialist of the various different types that deal with joint pains and problems like that.